Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient Tom. Tom was a patient several years ago that we took care of, for cluster headaches, and then subsequently he came in with some back pain. And why don't you just kind of tell the history of your back and your back surgeries and all that stuff, okay?
This is an old history, 40 years old. That's how long ago my first back surgery was. There were two subsequent back surgeries to deal with bulging discs, or in one case, it was described as an exploded disc. The first one was. They were about 7 years apart, strangely enough. They were in a row, L5, L4, L3. Partial relief for a little bit of time. I found some treatment modalities that strengthened my lower back and kept me out of trouble, but that didn't last for the rest of my life. 2 years ago I woke up unable to walk. My ability to move around the house was limited. I had to hang on to stuff. My legs were like two pieces of wet spaghetti. So almost complete loss of leg function and no particular explanation. My ability to balance probably was impacted by two earaches, two ear infections that were going on at the time, and I didn't know it. None of it went away until Dr. Roadhouse and I, excuse me, you're going to have to edit that out, until Dr. Roadhouse and I started working on my rebulged 3 discs. Yeah. An MRI revealed that all 3 of them were bulging again. Surgery obviously is out of question. It's nonsense at age 72 or whatever it was when it started, age 70. The progress has been incremental. I can pretty well motivate on my own without hanging on to anything. My balance has returned. The leg weakness is still present, but it's a lot better than it was 2 years ago when I woke up with it one morning and thought, death must be near. Something was going on. Had no idea. So we're busy re-evaluating, loosening the 3 vertebrae that have captured and make the discs bulge. That's pretty much behind us by now. Now I got to build the strength back in my legs so that I can in fact walk around the block. Haven't been able to do that for 2 years. That's my goal. Walk around the block without going into back spasms and legs that don't want to work and will ultimately collapse, I guess, if I pushed it.
Well, I just want to kind of go back and fill in some gaps here. So, he's had 3 back surgeries, and luckily they trimmed the disc, removed the disc that was bulging out, and they did a laminectomy, which is, like right here, they cut away part of the bone, and there's a disc bulge, and they just trimmed that part. And so the symptoms started coming back, and so when he'd been to a couple of doctors, and I can't remember, what did the one orthopedic surgeon over at the hospital say when you went in with the MRI? I mean, he said, did he say surgery, or did he say anything about your age, or what I can't remember exactly what he said. It's been a while. Something about the other surgeries, they came back, so did he want to do a fusion this time, or did he?
Well, the fusion was part of the conversation, but not recently. That goes back.
Okay, but not after you had the. So what happened is you had those 3 back surgeries and got some relief, and they came back, and then finally it got bad again. So we did an MRI, and we found you had the same 3 discs that you had before are bulging again.
Right.
Now you went and saw an orthopedic surgeon about that,
no.
didn't you? Okay, all right.
No, because I knew where
that
was
all right, okay. I know we had talked about that and everything. Yeah. So the same discs that they trimmed before are back bulging again, so they didn't fix it. So then from there, We got the MRI, we evaluated it, made sure he was a candidate for the decompression. We did all the cerebellum testing and the neurological testing, found out that his balance was really bad. And even though his balance was terrible when he had those ear infections, after the ear infections went away, you were still unsteady on your feet. The feet were weak, his balance was bad. So in the meantime, what we've been doing is we've been working on the neurological part of the treatment and putting him on oxygen and doing the cerebellar treatments to help with the cerebellum. Because the cerebellum has to do with balance and coordination, but it also controls all the muscles from the skull all the way down the sacrum. So to get a proper decompression, if it's tighter on one side, you're not going to get a full decompression. Instead of being like this, it's going to be more like that. So we worked on the cerebellum and did those treatments, and we were doing the decompression, and he had 3 different discs. So our table, the table that we have, you can angle it to hit the different discs. So we did one disc, then we moved on to the next one. And then now we're in the process of, doing the rehabilitation to strengthen up all the little muscles of the spine with the ATEM2 and the vibration platform and the exercise we got. So what we're going to do is, we've got good improvement, slow, but good. But now what we're going to do is get him to his ultimate goal. He wants to be able to walk around and have the confidence in his legs that he can do that, and they're not going to get weak, and they're not going to give you this, the trouble that, you had no confidence in your back or your legs to be able to do stuff like that, and you want to do that again. So we're going to do a video up until now, and then probably in about 3 months, we're going to do an update with him, and we'll see how your leg strength is, how your balance has been improved, how your back is doing, and if you're able to walk around the block yet several times. Okay?
Stunning.
Thank you for, you got anything else?
Yes, I do.
Okay.
The interface recently, when all this stuff popped up, was a primary care sending me off to have some testing done in the field of cardiology to see what pulse and blood flow I had in my lower legs. The results came back suggesting that the blood flow in my lower legs was not acceptable. In my upper legs, it was acceptable. So the next step that fellow decided was to send me off to a vascular surgeon. And I had to sit there and contemplate. I think I know where the vascular surgeon's going to go. I've been around this field for long enough to understand that we will start talking about cleaning out arteries with some rather vile tools, which won't do much for my lower legs, because you can't get to your lower legs, and all the other exciting medications that industry would have me take, which I don't think would make a bit of difference with what was going on. The interesting part was, if I'm having interference with the nerve supply to my lower legs because of my lower back, then a cardiology procedure is not going to have any impact on that. But the dilemma of deciding, you want to sit down and talk with a cardiologist about that, about the reduced neurological impulses to my legs because of my lower back problems? I don't think I'd get anywhere. And I didn't really feel excited about talking about it with them, because I knew that was a dead end. They don't understand any of that. And when you do talk in those terms with cardiologists or their related kin, the spine has got nothing to do with anything that they do. That's their impression. That's the way they were trained, and that's a mistake. Had I gone down that route, I don't think I would have gained anything except some pretty serious medical bills and some serious recovery time, and I'm not interested in doing that.
Yeah, I think what they were looking at is a condition called intermittent claudication,
Yeah.
which is, the blood vessels, they can't supply enough blood to the surrounding tissue. So then when you walk for about 15, 20, 30 feet, your leg muscles start screaming because of the walking increased load on the muscles. They need the blood supply to do that. That's not what you had. You know, you didn't have those type of symptoms, and you know, with pressure on the nerve going in the legs, I mean, it affects the blood vessel walls, and there's a lot of other things. And there are times when that's warranted, you know, but I think that's what they were, you know, heading down that path with you when they're talking about it. But it's kind of strange that the blood flow in the upper leg was okay, it's just in the lower leg. So something is going on there, because
that was the
that's
clue.
due to cholesterol clogging it, and it just doesn't do it here. It does it from here and goes all the way down.
Yeah.
So that's what your thought process was.
Yeah.
Okay, Tom. Well, we'll check back with you in probably about 3 months to see how the strength is and your balance and everything else, and make sure we're progressing satisfactorily.
And in that 3 month span, my hair will not be gray anymore, it'll be brown. Because of all this.
Because of the treatment?
Yes.
Ooh.
Is that, no pressure.
Yeah. Yeah, probably not gonna be able to do that one. I'm shooting for a walk around the block with your legs. All right, Tom, thanks.
Thank you for letting me